Do you ever feel like you outgrew high school but your skin didn't? Adult acne can feel confusing and really a little unfair. You're juggling school, work, family, stress, and suddenly your skin feels like it's back in ninth grade. Today I want to talk about why adult acne happens, why it's different from teenage acne, and how we actually treat it in a thoughtful and long-term way. Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Rostan, board-certified dermatologist and founder of Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life. Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here. Because healthy, beautiful skin isn't about perfection, it's about feeling confident and healthy. Let's get started. Hi, everyone. Dr. Elizabeth Rostan here of Charlotte Skin and Laser and Queen City Skin podcast. Today, I'm going to talk about something that we treat all day long, every day in the clinic, adult acne. And I can tell you these are frustrated patients. They're irritated. They're in their adult life juggling a lot of different things. And first of all, they don't want to come to the doctor to treat acne. They're supposed to leave that behind when they were teenagers. And it can really mar the confidence of an adult. These are commonly very obvious, large, deep cysts. They're painful. Maybe you have a big presentation and you've got this cyst here. I have patients that go on camera. They're being interviewed, they're speaking at meetings, they're speaking at board meetings, and they have a acne cyst on their face. They feel like they have to use a lot of makeup to cover it up, which is frustrating. They also feel a little singled out because it kind of is obvious when there's a big cystic lesion there. So the whole thing just kind of feels unfair. And frankly, as one who suffers from adult acne, these things hurt. It's just not fun. And I think they come up at like the worst times. Like you're away at a meeting and I'm sorry, but if you go to a dermatology meeting, I mean, you guys can imagine there's just like all these great looking people, or it's even worse at the cosmetic meetings. And then, Dr. Zit shows up. It's very frustrating for everyone. But why? I mean, it can happen to men, but it's a lot more common in women. For a variety of reasons, hormonal fluctuations, IUD, birth control pill, fertility treatments is a big driver, women during their family planning, pregnancy, postpartum, all these hormonal shifts can lead to it. And then none of that can cause acne too. Like you can just have normal Joe Blow and I'm getting acne. But women in particular do experience hormonal fluctuations with their menses, with their monthly cycle that can be frustrating. I mean, what is it? It really isn't teenage acne. Although teenage acne can have the cyst and things, it's kind of a transition. So one of the things that's gone is all those clogged pores. The blackheads become much less. The little, we call them closed comedones, a little underneath the skin. They're gone, but what comes up is kind of an undermining, deep, initiated, painful cyst, commonly on the chin and jawline, occasionally on the nose. So it feels different and it looks different. The treatments are different also. We're not using the benzoyl peroxide cleansers anymore. We might if you're very oily. It's another thing that's gone. Is the oily skin. It's just, my skin is great, but then I get this cyst. Stress, I think, plays a big role in this as well, that increased cortisol that comes with stress. Stress in the 20s is a little different than in the 30s, just different pressures. Job, work, school, then it moves into family, and juggling a lot of different things leads to a lot of different stress. When is this a problem? When does it signal that something's really wrong? I said it can happen during hormonal periods or while you're on the wrong birth control pill or an IUD or fertility treatments. But it can happen just with none of that. It really can. So when is it a problem? Because I get that question a lot. Do I need to get a hormone check? And I almost never do it. But what would drive me or your primary care physician to get a hormone check? Well, different things. Irregular periods is one, commonly skipping periods. Loss of hair on the top of your scalp, or growing hair on the chin or facial areas, that's a sign of a hormonal imbalance. You can also have weight gain. You can have mood shifts. You can have skin changes. And one of the skin changes that goes along with weight changes is a condition called acanthosis nigricans. And it is thick, darker, almost velvety looking skin, commonly around the neck, but can also happen in the folds like your underarm and your groin fold. If I see that change in anyone, acne or not, I will ask them about their glucose control and whether they've been tested for pre-diabetes, has their A1C been tested, that kind of thing. But when it's happening with menstrual irregularities and weight gain and some hair growth, then I'm going to be searching for a hormonal problem. That does not mean we're not going to treat your acne. We'll still treat your acne, but as a secondary side note, we may check some hormones. But most of y'all with these painful cysts, I've got bad news for you. You're going to have totally normal hormones, and we're just kind of stuck with our acne treatments. It's good news, bad news. Everyone wants an answer. Like if you have these big cysts, you want an answer. Like, why me? Why do I have these? And I can't answer that. I don't think I had acne as a teenager other than an occasional pimple. But boy, when I hit 19 or 20, it was on. And it's that shift, that hormonal shift, the change. So what about treatment? This when is over-counter not enough? I would say very quickly with hormonal acne. It just is really hard to treat with over-the-counter. We'll do an episode on early acne and how you can get started with treatment, and a lot of that is over-the-counter, very easy, accessible, fun stuff. But when you're getting these deep cysts, you often need our help. We do have a lot of women come in. They're like, I don't want a pill, an oral medication, but often we have to treat with that. So, what do we do? Well, I do a good exam, and I'm looking for any clogged pores. Again, blackheads are usually not numerous. Sometimes I'll see what's called a closed comedone. It looks like a little white bump under the skin. I'll send you down for a facial with the estheticians to get those opened up. You can do a hydrofacial with a chemical peel and extractions. It works great because those need to be physically removed or manipulated out. We can do cyst injections here in the clinic. It's a real great, quick fix. We do it all day long. I love telling patients about that. It's not always convenient, right? You can't always get here. But if you can, we can put an injection in it and help. For a take-home medicine spot treatment, I'll sometimes do a really strong steroid that you can dab on the spot. And that can help. That can kind of make it not last as long, not be so red. I mean, again, our goal is helping you, giving you the tools that you need to fix your skin condition, and that's just one of them. It's not perfect, but it's one, and I want you to have it because I want every tool you could possibly have. Topical creams we can use. A retinol is commonly what we use, which is over-the-counter. It's good for anti-aging, may help keep the pores away, but it's better tolerated than the tretinoin, which is the prescription form. We've got some well-tolerated forms of tretinoin here in our skin store. One of them is called Altreno, very well tolerated, but making you red, dry, and peely is not the answer to your hormonal acne. So we may kind of start with that. Here, try some retinol, try spot treating a cyst when it happens, or come in for a cyst injection. We do have some compounded androgen blocking creams that you can try. It's not as good as a oral medication, but I'll certainly recommend it. It's a good place to try. This kind of regimen is great for someone who has a cyst like once every 3 months or every other month, not every week. It's just not going to work. If the cysts are numerous and coming at a very regular pace every week, every month you're having a painful flare, then we will start an oral medication. That oral medication might be an oral contraceptive that does not produce an androgen effect. A popular one is Yasmin, and now there's generics of that. The oral contraceptive pills, if you look at it, there's estrogen in there, and then a slash, and then this big long name that's hard to pronounce. That's the progestin. Okay, it might say norgestimate or desogestrel, or for the case of Yaz or Yasmin, it says drospirenone. And drospirenone can help you with the hormonal acne. So if I determine that you're a candidate for an oral contraceptive and a low risk for a blood clot, I might suggest this to you. Not everybody's open to it, but sometimes just doing that can help. That was all that my hormonal acne needed throughout my entire 30s and into my 40s. But when I came off of it, I needed to do something else. So what else do we do? There's a medication called spironolactone, and it helps block the action of androgens at the oil gland and can be very, very helpful. Unfortunately, you can't just take it for flares. You have to take it all the time. Another thing we've learned about spironolactone, and any of you with a spironolactone prescription out there, pay attention. It really takes 12 weeks to work. 3 months, it's a long time. It takes a while to work, so don't give up. Keep taking it. Some people, not many, have a side effect that they don't like from it. It is a little bit of a diuretic. Maybe they feel dizzy. Maybe they're up at night going to the bathroom, or it causes irregular menses. Pretty rare, but it can happen. The other thing we can do is an antibiotic during the time of a flare. I don't like that one, but it's nice, again, having a tool. If you have gone out of town and you've got a bad acne breakout, just take some minocycline or doxycycline for that week. So we can also give that as a stopgap measure. But I think the message is there's definitely treatments. And for those of you who feel like maybe you're overreacting, or maybe you have a spouse that thinks you're overreacting, it's just a cyst. I mean, these things hurt, and they're cosmetically displeasing. They're embarrassing. Again, individuals are using a lot of makeup to cover them up. To me, and everyone here at Charlotte Skin and Laser, all the PAs, we treat this aggressively. We listen to you and go by what you're telling us. We'll do everything we can without an oral medication if you say that's not what you want. If it doesn't work, we'll try to encourage you to pursuing an oral medication. And we try to give you the tools for success, because this hormonal acne can be a bear. It's not just a cosmetic problem. So let's say you've started treatment and we've got you better. Unfortunately, these deep cysts, they often leave visible marks on the skin for quite a while, even after they've been long gone. Red marks or brown marks, or worse, scars if you've been picking. So what do we do about those? You can be really proactive with those with good wound care and not pick. It's just so compelling to pick these things. But nothing happens. They're not like something they're rarely, I should say, they're rarely anything you can pop. They're inflammation under the skin. And so picking and digging at them makes them worse. The other thing that happens is picking any scab that's formed after it's healed can make it worse. So I recommend no picking. I recommend good wound care if you have a scab. Maybe get it moist with some water and rub Vaseline on it. You're dying to get that smooth look to go out in the world. This is kind of embarrassing walking around with a scab, but moisten it, soak it a little bit, and rub some Vaseline. Or one of my favorites is the Elta Intense. And see if you can't soften it and lift it up. Don't pull it off. Let everything heal. And then for the red, we can do laser treatments that help speed up healing of the red. If you're prone to brown, we have a number of different laser treatments that can help speed up healing of the brown as well. I think the red goes away a little bit more quickly, Some individuals are so prone to the brown that the red equals will just lead to the brown. So it's nice to treat the red, so we might reduce the brown. But the best treatment is getting in, speaking to one of us here about getting on a treatment, following up. I tend to follow up with my patients pretty aggressively and early because I want to detect what road bumps you're having, what is not working, and where we can intervene to help you. And again, give you the tools to succeed in your treatment. If it's inconvenient for you to come in, we do offer telehealth services. Not great on a first appointment. It can be done, but certainly on a follow-up. And if you're having problems or struggling with the medications, a quick follow-up over the phone can really help straighten things out and get you back on track. So our goal, one of our mottos is success. And that's success for the practice. Everybody wants to work for a highly achieving, successful practice, but it's also success for our patients, for you. And I pound this into the physician assistants that work here. We are not getting success with this patient. What are we going to do? We got to do something else. We need to have success because that's why patients come to see us. Success is also meaning success for the people that work here. And that's why everyone is so happy and well-adjusted that work here. And it's just a nice place to come. They will listen to you. We will take you seriously and take your skincare problem seriously. So I encourage you to come in and get treatment if you're out there suffering from the nasty adult acne. Thank you for listening today to Queen City Skin Podcast. For the non-acne sufferers, I hope you learned a little something and just pat yourself on the back, feel lucky. For those of you that are suffering, I encourage you to get some help. Thanks for listening to Queen City Skin. We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too. If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom. And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser. Here's to healthy skin and feeling your best. We'll see you next time.